Hi guys, Kori Propst here, and I'm coming to you today at the request of a fairly new friend of mine named Maria Adelis, who I really respect and admire, particularly because of her tenacity and determination. She recently made me an administrator of a group that she created on Facebook called the Community Action Eating Disorder Awareness Group. And her impetus in starting the group was really to create, I think, a new level of responsiveness and a community in which individuals who have struggled with eating disorders or are struggling with eating disorders or disordered eating, and individuals from the healthcare community could band together, begin communicating in a more constructive way, to really open up a discussion regarding disordered eating and how we can best help people heal. So I want to thank her first for inviting me to be a part of it. It's an honor. But then to say that I really think we have to be careful about how we approach this. And I think we really need to honor and respect the privacy of the individuals who do want to be a part of the group. And it's not, so everyone knows at this point, it's not a closed group. So for those of you who are not comfortable sharing your stories and don't want them broadcasted out to the world, it's probably not the most appropriate place to do it. However, it is a place where you can read the stories of those individuals who are comfortable sharing, and to really view what other people have put into place and are practicing, healthcare providers included, including myself, in order to help people heal as effectively and as privately and as integratedly as possible. So Maria asked me to make a short video about anything. She said, "You can talk about anything, Kori," and so that really leaves the door wide open for me, and I could probably talk for hours, but I have 10 minutes, and so I really want to make this valuable for those of you who are watching it. But I might start by just introducing myself again and giving you a little bit of background on who I am. My name again is Kori Propst, and I am a licensed clinical mental health counselor. I am also a licensed professional counselor. And I work with a lot of individuals who have struggled or are struggling with disordered eating. What I want to make clear is that if an eating disorder is that serious that hospitalization is necessary, I'm not working with those individuals because they need much more comprehensive help. What I do want to make clear is that disordered eating is far from an issue related to food and eating. If it were just about food, I could feed an individual who was starving and they would thrive. And that would be the end of the story, except that's not what happens. Eating disorders are a very complex issue, complicated, and require a biopsychosocial approach. So we have to look at them from a biological perspective. We have to look at them from a psychological perspective and a mental perspective, an emotional perspective. And we absolutely have to include the social perspective in that. I struggled with disordered eating in my late teens when I first went off to college. And I could go into a big long story about what I believe the antecedents to have been. But what I know about myself through my healing process and what I learned was that I really lacked a secure and stable level of emotional intelligence in order to know how to manage, I don't like the word deal, how to manage and cope with difficulty and adversity and intense emotion. And I'm a pretty intense person, and I feel really deeply. I still do. That will always be a part of my character, a part of my personality. And pardon me, it wasn't until I decided to change, and you guys will hear how that happened for me eventually. It wasn't until I decided to change that I really learned to honor the intensity of my emotion and learned how to use it in a very constructive way. What I have found with so many of the women and men who I work with who struggle with disordered eating is that they lack a voice. They've either not been given an opportunity to speak up throughout their lives growing up, or they feel that they can't. There's a fear related to what will happen if they do. And so it's a relearning process in trusting that they can be themselves, they can speak up, they can make their needs and desires known, and being in a safe and secure enough place to understand that when they do, and that's why I think therapy is so effective, that when they do, it's going to be respected and honored and not ridiculed in any way. I think there's a misconception also about how eating disorders and disordered eating, and I'm really not a fan of diagnosis, to be honest, because it labels an individual in a way that sticks with them for their entire lives. And perhaps for some individuals, that can be part of the healing process. Now I understand, for example, what's wrong with me. But for a lot of individuals, that labeling can actually get in the way of them being able to move through and understand what they've struggled with. So I think that what I'm trying to say is that there's a misconception regarding maybe the most effective way to treat disordered eating, and while cognitive behavioral therapy, and that really is a way of helping people understand what their cognitions are and their thought processes are, the thoughts that come into their minds, learning how to recognize those and changing them to be more effective. That's what cognitive means. And then behavioral means to change our actions and the way that we respond based on our cognitions and thoughts. That's typically been the gold standard treatment for disordered eating and diagnosable eating disorders. However, what I've found is that we really need to honor and respect what those thoughts are, rather than trying to immediately just notice them and change them, because they have value, they have significance, and they can give us information about where this person is coming from, perhaps what happened in the past that led them to this place where they feel they have to be so rigid, in the case of anorexia, for example, or that they move toward a place that is so chaotic. When you look at any diagnosis, we tend to see that it moves toward rigidity or chaos. And chaos tends to be the path that someone who is engaging in bulimic sort of behaviors, binging and purging behaviors, gravitate toward. But when we see that honoring the thoughts gives us information, and that we don't immediately just change them, but we become and practice being more mindful of our thoughts, that to me is a lot more powerful. because I think that when we notice them and we automatically change them without giving them any credence, we're really ignoring a huge part of ourselves. Granted, what you learn through mindfulness is that a lot of our thoughts lie, but a lot of our thoughts and our patterns of behavior and our modes of communication and what we deem as threats in our environment, and individuals who usually struggle with disordered eating really anticipate and perceive a lot more threats in their environment, so it's much more difficult for them to navigate their lives or the circumstances in their lives in a very flexible, adaptive way. So learning how to be emotionally intelligent and not just focus on cognitive behavioral therapy, but more mind-body integrative sort of treatment and healing really gives the individual with disordered eating tendencies and or who are engaging in disordered eating specifically the ability to honor, respect, and then move forward in a very empowered and self-compassionate way. Because what we see with so many disordered eating individuals who are engaging in those behaviors is very shaming, blaming, self-loathing sort of behavior. And self-compassion is really what is necessary. Not just self-compassion, but a connection with other people in a very safe and secure environment that gives these individuals an ability to be themselves, try on new behaviors, and heal in a very comprehensive way. So I want to encourage anyone who is struggling with any sort of disordered eating, whether it's food restriction, whether it's individuals who have dieted 10, 15, 20 times and feel like they've failed themselves or failed their families because they've gained all their weight back. And that is who I work with a lot of times. I run the general population nutrition and weight loss program for the diet doc. And emotional eating that leads to binge eating, and that can be defined in many different ways. It's not all diagnosable. Food restriction, certain levels of restraint, body image issues, all of these things you can heal from. You can work your way through by learning new ways of thinking, learning new ways of behaving, opening up and discovering that there is a spaciousness within you that can create a container for what's uncomfortable. And so often we isolate, we try to push away, we try to avoid uncomfortable emotions or feelings, and what we end up doing is really having a difficult time recognizing in those moments what those feelings are telling us. Because they're signals. They're cues to listen up, to pay attention, to direct our focus and move our attention toward ourselves rather than away from ourselves, so we can really understand what we're experiencing and what we need. We have a few basic psychological needs that oftentimes, when they go unmet, will result in what's called compensatory behaviors. So whether it's emotional eating, whether it's binge eating, whether it's very restrictive eating, whether it's not eating at all, but moving towards other sort of addictive behaviors like shopping or porn or gambling, something like that. These are compensatory behaviors that are really designed to re-establish one or a few of these basic psychological needs, which are autonomy, competence, and relatedness/connection, except they don't do the job. They're a short-term fix, and So they will never fully replete the individual of a sense of internal, deep, meaningful, authentic satisfaction. So a lot of my work revolves around getting underneath the behavior to understand what the antecedents are of the behavior and to really assess with the individual what their basic psychological needs, how their basic psychological needs are met or not being met, or how they are being thwarted or threatened in some way. And this really opens up the individual to understanding how they have some power in exacting how their environment affects them and how their actions can move them closer to what's most meaningful for them and is really connected to the values that they have. So I think that I will end here. And I just want to say that, again, Maria, I appreciate the opportunity to be a part of this and to really get more information out there for those individuals who want to heal and who want to feel more empowered and who want to learn how to respond in their lives rather than be reactive and impulsive. And I think one of the number one things that this group is really going to facilitate is creating that very connective relatedness need that is part of the basic psychological needs. We all need people. We wouldn't survive without people. As much as we want to isolate a lot, we need that away time. It's okay to want to be by ourselves. But we absolutely, as human beings, would die, perish, without connection with other people. We need to be loved, and we need to be able to give love. And love is one of those primary characteristics, strengths, of individuals who experience the most life satisfaction and happiness. And so it's something that we really need to take seriously. We need to put more effort into seeing who is out there and to make eye contact with people and to really listen. And when we spend so much time on our computers and with our machines and on our phones and texting, instead of looking at each other in the eye, face to face, we really miss out on opportunities to thrive. So I want to thank you, and I look forward to being a part of this. And if anyone is interested in learning more about what I do, you can go to our website at www.thedietdoc.com. You can feel free to email me at Kori, spelled Kori, at thedietdoc.com. It's a great way to reach me. And I will also be in the group that Maria Adelis created, and I will be speaking with each of you soon. Thank you.